Welcome back, dear viewers. We have been joined with our third guest for this evening, Dr. Anas Aledan, specialist internal medicine and specializing fellow in rheumatology at the Royal Free Hospital in London. Hello and welcome, doctor.
Hello to you.
How are you doing this evening?
Great, thank you so much.
You're most welcome. So, doctor, can you tell us what is rheumatism?
Yes, so rheumatism is a term used commonly for musculoskeletal diseases, that is, the diseases involving the muscles and the skeleton, the bones, causing pain and disabilities, particularly joint problems. So it is a broad nomenclature of huge range of diseases that may affect the muscles, joints, and the bones, not related to a specific disease in itself. Yeah.
Yes, so rheumatism usually refers to various painful medical condition which affects joints, bones, and muscles. What are the difference between rheumatism and rheumatoid?
All right. The rheumatoid is just a term for rheumatoid arthritis, that is RA, which is a common autoimmune disease involving the joints mainly, as well as other organs, perhaps, while rheumatism is, as said, just a broad term of musculoskeletal symptoms. So rheumatoid arthritis or rheumatoid is referred to rheumatoid arthritis, one of the autoimmune diseases that is causing a rheumatism. So it is part of a group of diseases that tends to give rheumatism or pain all over the joint and muscles and the bones as well. Yeah.
Yes, so what are the symptoms of rheumatic disease? Because you just mentioned there are painful feelings in the bones and even in the joints. So what are the symptoms of the rheumatic diseases?
All right. So speaking about symptoms, the main symptom is joint pain, which is the most common one. And however, any organ really can be involved. For instance, like if the lungs are involved, then the patient will complain of shortness of breath. If the skin is involved, a rash may develop. So there are different types of presentation and symptoms. We call them systemic diseases, meaning that any system in the body can be involved. And according to the involved organ or part of the body, the symptom may come. So I would say, like if the heart is involved with anything, like in any disease of those diseases, patients may complain of palpitation or chest pain or shortness of breath. So any particular part of the body that can be involved, there are no specific symptoms apart from the joint pain themselves, which defines these types of diseases and disorders, I would say, yeah.
Yes, so what are the factors that increase the severity of such disease?
Well, there are not known factors. However, we know that genes and environment play a role in developing the autoimmune diseases. However, the causes are still unknown, still under studies and trials going on. No one knows. So there are no factors that really affect or may affect the diseases apart from what we know. So I would say just maintaining a general health and avoiding bad health habits in general is a wise thing for any kind of disease, including autoimmune diseases and rheumatism.
Yes, of course, this is very important to keep a healthy lifestyle that contributes in having a healthy body, a healthy mind, and a healthy soul. So the number of rheumatic disease is large in Kuwait. How big is it? The number of rheumatic disease, it's very large in Kuwait.
Yeah. Yes, indeed. Sorry, I was probably disconnected. There is a lag here in London. Yeah, so indeed, yeah, there will be like many people do have like osteoarthritis, which is a very common disease in Kuwait and the Gulf area, actually the Middle East and worldwide. Other diseases such as lupus and rheumatoid, we've encountered many cases and we diagnosed many cases in Kuwait. And if anyone would just put in like the Kuwait Rheumatology Association, a specific statistics, a very precise statistics about the number of patients in Kuwait are there. That can be looked at, yeah.
So do you think, is it possible that it is something genetic since we have such a large number here in Kuwait, or is it something associated with something else?
Well, it depends on the disease itself. Like for the osteoarthritis, it is common disease, a degenerative aging disease, while the other autoimmune diseases are diseases that are associated with genetics and environment. So it really depends on the type of the disease itself. The common one, the osteoarthritis, is the one that we tend to have as we age, where there is a broken cartilage surrounding the bones in the joints, where patients having pains at the knees, specifically the weight-bearing joints, specifically the knees.
Yes.
And this is a very common, and we have many different treatment modalities for these type of presentation and disorders. Yeah.
Yes, so is there any curable information or exercises or something we can do for rheumatic disease? Is it curable?
Well, rheumatic diseases or the autoimmune disease, I would say, they are not curable. However, they are treatable, meaning there are treatments that slows down the activity of the diseases and managing the symptoms rather than cure them. So it is not like a flu where ones have symptoms and then they melt away. No, it's a chronic disease that tends to give rise to a different symptoms. However, they are treatable, and we have many treatment approaches and treatment modalities. Many brilliant drugs are available to treat such diseases. And the advancement in this particular area in medicine is really evolving.
Yes, we have noticed a lot of development in the medicine industry and even in hospitals and treatment as well. Thank you so much, Dr. Anas Aledan. It's a pleasure to have you with us on Hala Kuwait.
You're welcome. Thank you so much for hosting.
You're most welcome. Dear viewers, we have reached the end of tonight's episode. We hope you enjoyed the interview segments that majorly focused on narcissism as well as rheumatology. We hope you enjoyed our reports, our interview segments, and everything in between. Have a wonderful evening, stay safe, and good night.